Hi, my name is Max, and I just finished the 4th grade. Last week, I had surgery. When my mom told me I had to go to the hospital, I had a lot of questions. Are you going to the hospital too? Maybe you're having a surgery, a procedure, or a scan, like an MRI. Let me show you what it was like for me when I had my surgery. When I woke up on the morning of my surgery, I couldn't eat breakfast. That was hard because my stomach was hungry. When we got to the hospital, we took an elevator to the 4th floor and checked in at a place called the frog desk. My mom and I hung out in the waiting room, and when it was my turn, a friendly guy led us down the hallway to our pre-op room. My favorite part was looking for the butterfly, bird, and frog on our way. This is where I got ready for my surgery. We started the movie on the TV while we waited for the nurse to meet us. The nurse came in and asked me a few questions. We went down the hall to see how tall I was and how much I weighed. Next, he checked my temperature. Then my nurse needed to know how I was breathing. He placed a sticky band-aid with a sensor called a pulse ox around my finger that had a red light. I could see my oxygen level and heart rate on the monitor. He put the blood pressure cuff on my arm. It gave my arm a kinda tight squeeze. We used a stethoscope to listen to my heartbeat. Then my nurse asked me to put on hospital pajamas, and my mom put all my clothes, even my underwear and socks, in a special bag for when I was done with my surgery. I was also given a special bracelet with my name on it. After that, I met the people who would be taking care of me in the operating room during my surgery. My operating room nurse wanted to see my new special bracelet and asked a few more questions to get to know me better. Next, I met the team who would give me sleep medicine during my surgery. They told me the sleep medicine is called anesthesia. They said that there were 2 ways to get the anesthesia medicine into my body. One way was breathing into a mask, and the other was getting it through the world's tiniest straw called an IV. My mom and the team talked and made a plan for me. I used the mask. I learned that when I breathed into it, the anesthesia would keep my body asleep and help me not feel anything during my surgery. I was starting to feel a little nervous, so my nurse called over a child life specialist. She showed me pictures of the rooms I'd see so I know what to expect. They had an awesome activity room. I even brought some toys back to my room. Some kids drink medicine before they go back for surgery. I chose a cup. When it was time for my surgery, I got to ride on my bed to the operating room. On the way, we looked at all the cool fish on the river wall. In the operating room, I saw big lights on the ceiling. My nurse told me that these were spotlights because I was a superstar for the day. I looked around and saw lots of machines. I learned that my surgery team uses these machines to help take good care of me during my surgery. Then they helped me sit on a special bed. It had a seatbelt to keep me safe during my surgery. They put the blood pressure cuff and pulse ox back on, and then put stickers on my chest to watch my heartbeat. It made me laugh. They even gave me a warm blanket. Everyone looked a little goofy with their hat and masks on. I could tell that they were smiling and happy to see me. They looked at my bracelet and asked me my name and birthday. Then it was time for me to breathe through the mask and I went to sleep. After I was asleep, my team placed an IV, which is a tiny straw, on my hand. They used the IV to give my body a drink of medicine. When my surgery was all done, I woke up in the recovery room. I noticed the IV on my hand. It looked a little weird, but it didn't bother me. My mom came to see me in this room. When I was ready, my nurse came in and asked me if I wanted juice or a popsicle. Then he took out my IV and put a Band-Aid on my hand. All I felt was the tape pulling a little. If you end up spending the night in the hospital, the IV will stay in for more medicine until it's time to go home. They even have a place for a grown-up to sleep in your room. I went home after my surgery. When it was time for me to leave, I got to ride in a wheelchair to my car. Thanks for listening to my surgery story. I hope this helped you feel more comfortable about coming to Mott Children's Hospital for your surgery or procedure. If you have any questions, make sure to ask someone. Everyone is here to help.